Welcome to class, students. Today, we'll be looking at a very important course titled Public Health and Safety. And under it, we'll be looking at a very vital topic titled Introduction to Public Health and Safety. Public health safeguards and enhances well-being across entire communities. This field applies scientific research and evidence-based approaches to create environments where people can safely live, learn, work, and play. It applies to different scientific and evidence-based approaches. It helps to create an environment where people can safely live, where you can learn, where you can work, where you can associate, and where we can play. Public health encompasses multiple interconnected domains focused on protecting population well-being. Core areas include communicable disease control, environmental health protection, health equity promotion, and disaster readiness planning. So it encompasses the communicable disease control, how to control diseases that are contactable, diseases that are communicable, the environmental health protection, and where they ensure the sanity of the environment and yes, the cleanliness of the environment. Health equity promotion, you have to promote health equity that ensures that everybody, both gender, male, female, poor and rich, have access to health facilities and care. Then disaster readiness and planning. Specialists might focus on specific concerns like tracking disease spread patterns, mitigating workplace hazard, or addressing how climate shifts affect community health outcome. Functions of public health. We have population health status surveillance, analysis and evaluation. So public health helps in population health status, helps in surveilling the population, helps to carry out analysis and evaluation of the entire population health. We also have health status monitoring to identify community health challenges. Public health helps to check the health status of a community in order to identify the the health challenges they are facing, or the one that is paramount in the community. We also have investigation of environmental health hazards and community health risks. Environmental and health monitoring to address community environmental health issues. They also function as a way of rapid and effective response to emerging health problems. For example, when you have a case of COVID-19 or any pandemic or malaria, polio, any infection, any communicable disease, public health help in rapid and effective response to those emerging health problems. We also have development of effective health protection programs and facilities, systematic evaluation of public health policy, strategies and infrastructure. So we want to look at essential elements of modern public health. We have collective responsibility approach, government leadership in public health protection and promotion, collaborative partnership with served populations. We also have prevention of centered focus, recognition of socioeconomic health determinants. So I want to take the importance of public health. We have been saying most of the functions we've read or we've talked about is about promotion of health, protection of the environment, protection of the population, checking the health status and the health problems, challenges, the health problems in the community or in the society. Now I'm going to looking at the importance of public health. Public health initiatives improve quality of life, support child development, minimizes suffering and provide economic benefits. These are importance of public health. Improve the quality of life through the services they give, then support child's development, minimize suffering and provide economic benefits. This effort often work invisibly to prevent hazard and maintain community wellness through disease surveillance and community immunization program wey you dey immunize children under a specific age, so that when you give them polio vaccine, or just to prevent them or to improve their immune system. That is workplace safety standard development. They also do programs in schools to promote school nutrition, or they help in the implementation of school nutrition programs. Safety litigation advocacy, including smoke-free spaces and seat belt requirements, gun violence prevention strategy. They also help in climate change health impact assessment. Public health also help in addressing racism as a public health crisis. So public health professionals, we have different professionals in public health. We have the health protection specialists, which include the restaurant inspectors or restaurant inspectors. We have the sanitarians. We have those ones that are in charge of the environment, the community. They ensure cleanliness and sanity in the environment. We also have occupational safety experts and first responders. We also have the community health professional, which encompasses the health educators, community health workers, nutritionists, social workers, and community planners. Public health versus healthcare. Why healthcare system treat individual after they become ill? Public health focuses on preventing illness and injury before they occur. So we want to look at the difference between public health and healthcare. Healthcare system involve treating of individuals that are sick, that are ill, that are not feeling fine. So that these are the functions. That is the work of healthcare people. While the public health focuses on preventing such illness from coming or from you encountering such illness through the sanitization of the environment, promotion and implementation of school nutrition, through prevention of health crisis, racism. So those are the work of public health people. Healthcare addresses individual patients' needs, whereas public health considers the entire population well-being and collective health outcomes. So public health, it deals with a whole community, their well-being and collective health outcomes, while the healthcare deals with individual, talks about individual, the needs of the patient, the individual needs of the patient. So public health activities, it has to do with epidemic prevention, that is protection of environmental system, workplaces, housing, food and water resources, population health status monitoring, community action mobilization. They deal with community action mobilization, deals with protection of environmental system, workplaces, housing, food and water resources, epidemic prevention. We also have disaster response coordination. They also deal with outreach to connect high risk and underserved population with necessary service. They deal mostly with providing services to everybody without criticism, without racism. So they will deal both the low, the high, the underserved population, the highly served population. Research to develop innovative solution and insight. So public health activities also involve research, develop innovative solution and insight, leadership in sound health policy development and planning. Public health professionals develop crucial relationships with residents and service providers, enabling them to identify local health risks, educate communities about healthy practices and establish services addressing care gaps. Unlike broader healthcare system, community health focus specifically on location-based determinants, while helping hospital improve chronic disease management and prevent readmissions. So community impact through personalized care. Local public health initiative creates meaningful difference in individual lives. When a new mother receives home nursing support or diabetes patients find symptom management through specialized clinics, this represents a public health principles in action. Community health professionals excel by customizing intervention for public population while improving health care accessibility. This initiative directly addresses healthcare gaps, particularly for underserved communities facing insurance barriers or provider shortages. Community clinics frequently serve as an essential primary care resources where socioeconomic factors might otherwise prevent equitable. Thank you very much for listening.